Sarah Martinez had been working the night shift at St. Mary's General Hospital for 8 years. Her hands moved with practiced precision as she checked the monitors surrounding bed 14 in the cardiac intensive care unit. The steady beeping of machines filled the quiet corridor, punctuated only by the soft shuffle of her rubber-soled shoes against the polished linoleum floor. Behind the privacy curtain lay Thomas Brennan, a 72-year-old Vietnam veteran who had been admitted 3 days earlier following a severe heart attack. His weathered face bore the lines of a man who had seen too much, fought too hard, and carried burdens that most people could never understand. His graying hair was cropped short in a military style that he had maintained for over 5 decades, and even in his weakened state, there was something unmistakably dignified about his presence. Sarah had developed a special connection with Thomas during his stay. Unlike many patients who complained constantly or demanded immediate attention for minor discomforts, Thomas never asked for anything. He thanked her for every small gesture, from adjusting his pillow to bringing him an extra blanket during the cold hospital nights. When she asked about his pain level, he would simply nod and say he had experienced worse, though she could see the discomfort in his eyes. During her breaks, Sarah would sit beside his bed and listen to his stories about his time in Vietnam. He spoke of friends he had lost, battles he had survived, and the difficulty of returning home to a country that seemed to have forgotten about the war and the young men who had fought in it. His voice would become distant when he talked about those days, as if he was seeing ghosts that only he could perceive. Thomas had no family listed as emergency contacts. His wife had passed away from cancer 6 years earlier, and they had never had children. His only listed contact was a neighbor who checked on his mail when he was away. Sarah learned that he lived alone in a small apartment across town, surviving on a modest veteran's pension and Social Security. Despite his isolation, he never complained about loneliness or expressed self-pity. On Thursday morning, Dr. Rebecca Harrison made her rounds earlier than usual. She was the hospital's chief administrator, a woman in her mid-50s who had built her career on efficiency and strict adherence to hospital policies. Her auburn hair was always pulled back in a perfect bun, and her tailored suits never showed a wrinkle. She carried herself with the authority of someone who had worked her way up through the medical bureaucracy and demanded respect from everyone under her supervision. Dr. Harrison stopped at the nurses' station where Sarah was completing her overnight reports. The morning shift would arrive in 2 hours, and Sarah was methodically documenting every medication administered, every vital sign recorded, and every change in patient condition during her 12-hour shift. "Nurse Martinez, I need to speak with you about patient Brennan in bed 14, Dr. Harrison said, her voice carrying the crisp tone of someone accustomed to giving orders. Sarah looked up from her paperwork, sensing tension in the administrator's demeanor. "Yes, ma'am. Is there something wrong with his treatment plan? I've been reviewing the meal charges for his stay, and I noticed that you've been providing him with additional food items that aren't covered under his insurance plan. Specifically, you've been giving him extra portions and ordering special dietary accommodations that exceed what his veterans' benefits will cover." Sarah felt her stomach tighten. She had indeed been making sure Thomas received adequate nutrition, knowing that he was underweight and that proper nutrition was crucial for his recovery. The standard hospital meals were often insufficient for patients recovering from major cardiac events, and she had noticed that Thomas rarely finished even those small portions. "I was ensuring he received proper nutrition for his recovery," Sarah explained carefully. "His body mass index indicates he's been undernourished, and cardiac patients need adequate protein and nutrients to heal properly." "That's not your decision to make, Doctor," Harrison replied firmly. "We have dietary staff and physicians who determine appropriate meal plans. More importantly, we cannot provide services that exceed what insurance will cover without prior authorization. The hospital cannot absorb these additional costs." Sarah took a deep breath, knowing she was about to enter dangerous territory. "Dr. Harrison, with respect, we're talking about maybe $15 worth of additional food over 3 days. This man served his country for 2 tours in Vietnam. He's here alone, with no family, living on a fixed income. Surely we can show some compassion for someone who sacrificed so much for all of us." Dr. Harrison's expression hardened. "Nurse Martinez, your job is to provide medical care according to established protocols, not to make policy decisions based on your personal feelings about a patient's background. We have rules and procedures that everyone must follow, regardless of circumstances. But he's a veteran, Sarah persisted, her voice rising slightly despite her efforts to remain professional. He gave years of his life to serve this country. He was wounded in combat and received a Purple Heart. Don't we owe him at least basic dignity and care? What we owe him is professional medical treatment within the parameters of his insurance coverage. Dr. Harrison replied coldly. Your emotional attachment to this patient is clouding your judgment and causing you to violate hospital policy. This is not the first time we've had concerns about your tendency to become too personally involved with patients. Sarah felt her cheeks flush with anger and frustration. She had always prided herself on providing compassionate care, going above and beyond for patients who needed extra support. In her 8 years at the hospital, she had received commendations from families, thank you cards from grateful patients, and recognition from her supervisors for her dedication. Now she was being criticized for showing basic human kindness to a man who had given so much to his country. I believe every patient deserves compassionate care, Sarah said, trying to keep her voice steady. That's why I became a nurse. If ensuring a veteran receives adequate nutrition during his recovery is considered too personal, then maybe this hospital has lost sight of what healthcare should really be about. 1. Dr. Harrison stepped closer to the nurse's station, her voice dropping to a low, warning tone. Nurse Martinez, you are walking a very fine line. Your job is to follow orders and adhere to hospital policies, not to lecture your superiors about healthcare philosophy. I'm placing a formal warning in your personnel file regarding this incident. Sarah felt something snap inside her. 8 years of watching patients suffer due to bureaucratic indifference. 8 years of seeing healthcare reduced to profit margins and insurance limitations, and now being reprimanded for showing kindness to a veteran who had sacrificed for his country. She looked Dr. Harrison directly in the eyes and spoke with quiet intensity. I will not apologize for treating a war hero with the respect and dignity he deserves. If this hospital is more concerned about $15 in food costs than showing basic gratitude to someone who served his country, then perhaps you need to examine your own priorities. The silence that followed was deafening. Other nurses at nearby stations had stopped their work and were watching the confrontation unfold. Dr. Harrison's face had turned pale, then red with anger. For a moment, neither woman spoke, the tension hanging in the air like a storm about to break. Clear out your locker, doctor, Harrison said finally, her voice ice-cold. Your employment with St. Mary's General Hospital is terminated, effective immediately. Security will escort you from the building. Sarah felt the words hit her like a physical blow. 8 years of dedicated service, countless lives she had helped save, relationships she had built with colleagues and patients, all ending because she had dared to show compassion to a veteran who needed it. She looked around at her fellow nurses, some of whom avoided her gaze, while others watched with sympathy and shock. You're firing me for caring about a patient? Sarah asked, her voice barely above a whisper. I'm terminating your employment for insubordination and violation of hospital policies, Doctor, Harrison replied formally. Your personal feelings about patients cannot override established procedures. As Sarah walked to the break room to clean out her locker, her hands were shaking. She had always known that healthcare was becoming more corporate and less compassionate, but she had never imagined she would lose her job for showing kindness to a veteran. The irony was not lost on her that the man in bed 14 had fought for the very freedom that should have protected her right to speak up for what was right. 20 minutes later, she found herself standing in the hospital parking lot at 6 in the morning, holding a cardboard box containing 8 years of her professional life. The security guard who had escorted her out was apologetic but firm. Hospital policy required immediate removal of terminated employees, regardless of the circumstances. As she sat in her car, Sarah looked back at the hospital where she had dedicated nearly a decade of her life to caring for others. Somewhere inside those walls, Thomas Brennan was probably waking up alone, wondering why his nurse hadn't come to check on him during the morning medication rounds. He would never know that his care had cost someone their livelihood, and she hoped he never would. The drive home was a blur of anger, sadness, and disbelief. Sarah had always believed that healthcare was about healing, about showing compassion to those who were suffering, about treating every patient with dignity regardless of their ability to pay. Now she was learning that those ideals were luxuries that hospitals could no longer afford in an era of corporate medicine and bottom-line thinking. When she finally reached her apartment, she sat on her couch and stared at the cardboard box of her belongings. Inside were photographs of patients who had recovered because of her care, thank you cards from grateful families, and her nursing school graduation photo. She wondered if she would ever work in healthcare again, or if her termination would follow her wherever she applied for new positions. But as the morning sun streamed through her windows, Sarah felt something unexpected alongside the pain and anger. She felt proud that she had stood up for what was right, proud that she had defended a man who had given so much to his country, and proud that she had not compromised her values, even when it cost her everything she had worked for. Thomas Brennan deserved better than a healthcare system that measured his worth in dollars and cents. Every veteran deserved better. And if her sacrifice could somehow draw attention to the way hospitals were treating the men and women who had served their country, then perhaps her termination would not be in vain. News of Sarah Martinez's termination spread through St. Mary's General Hospital like wildfire. By the afternoon shift change, nearly every nurse, orderly, and physician knew the basic facts. A dedicated nurse had been fired for providing extra food to a veteran patient. The details varied depending on who was telling the story, but the core message remained consistent and deeply troubling to many staff members. Jennifer Walsh, a nurse who had worked alongside Sarah for 5 years, was among the first to learn what had happened. She found out when she arrived for her afternoon shift and discovered that Sarah's name had already been removed from the duty roster. When Jennifer asked about the sudden change, her supervisor reluctantly explained the situation, emphasizing that all staff should take this as a reminder to follow hospital policies without exception. Jennifer felt sick to her stomach. She remembered countless times when Sarah had gone out of her way to help patients, families, and fellow staff members. Sarah was the nurse who stayed late to comfort grieving families, who used her own money to buy birthday cards for patients who had no visitors, and who consistently received the highest patient satisfaction scores in their unit. The idea that such a dedicated caregiver could be dismissed for showing kindness to a veteran seemed like a betrayal of everything they had sworn to uphold when they took their nursing oaths. As Jennifer began her rounds, she stopped by bed 14 to check on Thomas Brennan. The elderly veteran was awake, but seemed confused and concerned. His usual gentle smile was replaced by a worried frown, and he kept glancing toward the door as if waiting for someone. "Good afternoon, Mr. Brennan," Jennifer said softly. "I'm Jennifer, and I'll be taking care of you during this shift." Thomas looked at her with kind but troubled eyes. "Where's Sarah?" "She's been looking after me since I arrived, but I haven't seen her since last night. I hope she's not sick or anything." Jennifer felt her throat tighten. Hospital policy prevented her from discussing personnel matters with patients, but she could see the genuine concern in Thomas's face. This man clearly cared about Sarah just as much as she had cared about him. "She's not working today," Jennifer managed to say. "But I'll make sure you receive excellent care." Thomas studied her face carefully. Despite his age and illness, his mind remained sharp, honed by decades of military training and life experience. "Something's wrong, isn't it?" Sarah wouldn't just disappear without saying goodbye. She's not that kind of person. Jennifer busied herself with checking his monitors and adjusting his medications, trying to avoid his penetrating gaze. But Thomas was persistent. "Nurse Jennifer, I've been around long enough to know when someone is avoiding the truth. What happened to Sarah?" Finally, Jennifer sat down in the chair beside his bed. She looked around to make sure they wouldn't be overheard, then spoke in a low voice. "Mr. Brennan, Sarah was dismissed this morning. The hospital administration felt she violated policies by providing you with additional food and care that wasn't covered by your insurance." Thomas was quiet for a long moment, processing this information. His hands, marked by age spots and the scars of old wounds, clenched into fists on top of his blanket. When he finally spoke, his voice carried a mixture of anger and deep sadness. "They fired her for taking care of me? For making sure I had enough to eat?" Jennifer nodded, unable to trust her voice to remain steady. Thomas closed his eyes and leaned back against his pillow. For several minutes, neither of them spoke. Jennifer could see the conflict playing out on his weathered face. The guilt of knowing that someone had lost their job because of kindness shown to him. "That girl has more heart than this entire hospital administration," Thomas said finally. "In Vietnam, we had a saying, 'You never leave a man behind.' Sarah lived by that principle, and they punished her for it." Word of the incident continued to spread beyond the hospital walls. Jennifer, despite the risk to her own job, told her husband about what had happened when she arrived home that evening. He worked at a local veterans organization and was outraged by the story. Within hours, he had shared it with other veterans in their community, each retelling, adding fuel to a growing fire of indignation. By the next morning, the story had reached Marcus Thompson, a local reporter for the city's largest newspaper. Marcus specialized in human interest stories and had a particular interest in veterans' issues, having served in Afghanistan himself before transitioning to journalism. When he heard about a nurse being fired for caring for a Vietnam veteran, he knew he had found a story worth investigating. Marcus arrived at St. Mary's General Hospital on Friday afternoon, requesting an interview with Dr. Rebecca Harrison about the termination of Sarah Martinez. The hospital's public relations department initially tried to deflect his questions, stating that they could not discuss personnel matters. However, Marcus had done his homework and knew how to ask the right questions to get the information he needed. "Dr. Harrison," Marcus said during their brief phone conversation, "I'm not asking you to discuss private personnel matters. I'm asking about hospital policy regarding veteran patients, and whether your facility has adequate procedures in place to ensure veterans receive appropriate care." Dr. Harrison, realizing that the story was not going away, agreed to a carefully controlled interview. She repeated the hospital's position that all patients, regardless of their background, received care according to established medical protocols and insurance coverage limitations. She emphasized that the hospital followed all federal and state regulations regarding veteran care, and that any suggestion otherwise was unfounded. However, Marcus had also reached out to other hospital staff members, speaking with them off the record. The picture that emerged was of a dedicated nurse who had been terminated for showing basic human compassion to a veteran patient. Several nurses confirmed that Sarah was known for going above and beyond for patients, and that her termination had created a morale crisis among the nursing staff. When Marcus attempted to interview Sarah, she was initially reluctant to speak with the media. She had always preferred to let her work speak for itself, and was uncomfortable with the idea of public attention. However, when she learned that other veterans might be affected by the hospital's rigid policies, she agreed to tell her story. "I didn't speak up for Thomas Brennan because he was a veteran," Sarah told Marcus during their interview at a quiet coffee shop downtown. "I spoke up for him because he was a human being who needed care and compassion. The fact that he served his country and sacrificed for all of us just made the hospital's treatment even more unconscionable." Sarah explained how she had watched over the years as healthcare became increasingly focused on profit margins rather than patient care. She described seeing elderly patients discharged too early because their insurance wouldn't cover extended stays, watching families forced to choose between proper treatment and financial ruin, and witnessing the gradual erosion of the compassionate care that had drawn her to nursing in the first place. "Thomas Brennan asked for nothing," Sarah continued, her voice filled with emotion. "He never complained, never demanded anything, always said thank you for the smallest gestures. When I saw that he wasn't getting adequate nutrition to support his recovery, I couldn't just stand by and do nothing. If that makes me unsuitable to work in healthcare, then the system is more broken than I thought." Marcus also managed to interview Thomas Brennan during visiting hours, with the veteran's permission. Thomas was still recovering, but was mentally sharp and articulate about his experience. He spoke with passion about Sarah's dedication and kindness, describing how she had made him feel valued and cared for during one of the most vulnerable periods of his life. "I've been in hospitals before," Thomas told Marcus, his voice strong despite his physical condition. "I've seen good nurses and bad nurses, caring staff and indifferent staff. Sarah Martinez is the kind of nurse who reminds you why you chose to keep fighting, why life is worth living. She treated me with dignity when I had nothing to offer in return except gratitude." Thomas also shared his perspective on the broader issue of veteran care. He described friends who had struggled with inadequate healthcare, bureaucratic indifference, and a system that seemed to view veterans as inconvenient reminders of wars that most Americans preferred to forget. The firing of a nurse for showing kindness to a veteran patient was, in his view, symbolic of a larger problem in how society treated its military veterans. "We asked young people to go fight in places most Americans couldn't find on a map," Thomas said, his eyes distant with memory. "We promised them they would be taken care of when they came home. For too many of us, that promise has been broken. When someone like Sarah tries to honor that promise and gets punished for it, that tells you everything you need to know about where we are as a country." Marcus's article was published on Sunday morning under the headline, "Nurse Fired for Caring. Veterans Treatment Raises Questions About Hospital Priorities." The story provided a detailed account of Sarah's termination, her history of excellent patient care, and Thomas Brennan's perspective as a veteran who had witnessed firsthand the compassion that cost someone their job. The response was immediate and overwhelming. The newspaper's online version of the article received hundreds of comments, most expressing outrage at the hospital's decision and support for Sarah Martinez. Local veterans organizations began organizing, discussing ways to support both Sarah and other veterans who might be facing similar treatment at area hospitals. Social media amplified the story's reach far beyond the local community. Veterans from across the country shared the article, adding their own experiences with healthcare systems that seemed more focused on bureaucracy than patient care. Nursing organizations picked up the story, using it as an example of how healthcare workers were being forced to choose between their professional ethics and their job security. By Monday morning, Dr. Rebecca Harrison was facing a public relations crisis, unlike anything she had experienced in her administrative career. The hospital's phone lines were overwhelmed with calls from concerned community members, veterans advocates, and media outlets requesting statements about their policies regarding veteran care. Several major donors to the hospital had called expressing their concern about the negative publicity surrounding the institution they had supported for years. Meanwhile, Sarah was discovering that her story had touched a nerve far beyond what she had ever imagined. Veterans from across the country were reaching out to thank her for standing up for one of their own. Nursing colleagues from other hospitals were expressing support and sharing similar stories of being pressured to prioritize financial considerations over patient care. Job offers were beginning to come in from healthcare facilities that wanted to hire a nurse with her demonstrated commitment to compassionate care. But for Sarah, the most meaningful response came from an unexpected source. On Monday evening, she received a phone call from a man who identified himself as Robert Brennan, Thomas's younger brother. Robert had served in the Army during the Gulf War and had been estranged from Thomas for over a decade due to family disagreements that now seemed trivial in light of recent events. "Miss Martinez," Robert said, his voice thick with emotion, "I read about what you did for my brother, and what it cost you. I haven't spoken to Thomas in years, but your story made me realize how stupid I've been. Family is family, and life is too short for petty grudges. I'm driving up from Florida tomorrow to see him, and I wanted you to know that what you did didn't just help one old veteran. You helped heal a family." As Sarah hung up the phone, she felt tears running down her cheeks. Perhaps losing her job had been worth it after all. If it could bring a family back together and draw attention to the need for better veteran care. She had no idea that her story was about to take another dramatic turn, one that would involve someone she had never met, but whose life had been shaped by many of the same values that had guided her decision to stand up for Thomas Brennan. General Patricia "Pat" Sullivan had spent 35 years in the United States Army, rising through the ranks to become one of the most respected four-star generals in the military. At 62, she commanded the respect of soldiers, politicians, and civilians alike, having led troops in Iraq and Afghanistan while also serving in various Pentagon positions focused on veteran affairs and military health care. Her silver hair was always perfectly arranged, her uniform immaculate, and her bearing unmistakably military even in civilian clothes. On Tuesday morning, General Sullivan was in her Pentagon office reviewing reports about veteran health care when her aide, Colonel James Martinez, knocked on her door. Colonel Martinez had served under the general for 8 years and had never seen her react emotionally to routine briefings, but today would be different. "General, there's a story out of St. Mary's General Hospital that I think you need to see," Colonel Martinez said, placing a printed copy of Marcus Thompson's article on her desk. It involves a nurse who was fired for providing extra care to a Vietnam veteran. General Sullivan read the article with growing intensity. As someone who had dedicated her career to military service and veteran welfare, she was deeply troubled by the account of Sarah Martinez's termination. But there was something else about the story that struck her personally. Sarah Martinez was not just any nurse. She was the daughter of Sergeant First Class Miguel Martinez, a soldier who had served under General Sullivan's command in Afghanistan 15 years earlier. General Sullivan remembered Miguel Martinez clearly. He had been a dedicated medic who had saved countless lives during their deployment, including her own when their convoy was attacked by insurgents outside Kandahar. Miguel had pulled her from a burning vehicle and provided medical care under enemy fire, actions that had earned him a Silver Star and her eternal gratitude. Tragically, Miguel had been killed by an improvised explosive device just 2 months later, leaving behind a wife and young daughter. The general had attended Miguel's funeral and had promised his widow that she would always be available if the family needed anything. Over the years, she had kept track of the family's progress, learning that Miguel's daughter had followed in her father's footsteps by choosing a career dedicated to helping others. Sarah had become a nurse while her father had been a medic, both professions focused on saving lives and providing care to those in need. Now, 15 years later, Miguel's daughter was being punished for showing the same kind of compassion and dedication to duty that had defined her father's military service. General Sullivan felt a personal responsibility to address this situation, both as someone who cared about veteran welfare and as someone who owed a debt to Sarah's family that could never be fully repaid. General Sullivan immediately canceled her afternoon meetings and instructed her aide to arrange transportation to the hospital. She changed from her military uniform into civilian clothes, a sharp business suit that still conveyed authority, but wouldn't immediately identify her as military personnel. Her plan was to visit the hospital quietly, assess the situation firsthand, and determine how she could help both Sarah Martinez and Thomas Brennan. The drive from Washington to St. Mary's General Hospital took 3 hours, giving General Sullivan time to think about the broader implications of what she had read. The story represented everything that was wrong with how America sometimes treated its veterans. Bureaucratic indifference, prioritizing costs over care, and punishing those who tried to do the right thing. As someone who had spent decades ensuring that military personnel received proper support, she was determined to address this situation. General Sullivan arrived at the hospital on Tuesday afternoon, just as the day shift was ending and the evening staff was beginning their rounds. She walked through the main entrance with the confident stride of someone accustomed to command, her presence immediately noticeable to anyone who happened to be watching. Despite being in civilian clothes, there was something unmistakably military about her bearing that caused people to take notice. At the information desk, General Sullivan asked to speak with Dr. Rebecca Harrison about veteran patient care policies. The volunteer at the desk, an elderly woman named Mrs. Chen, who had been working at the hospital for 12 years, was initially polite but explained that Dr. Harrison was in meetings and didn't typically see visitors without appointments. "Ma'am," General Sullivan said with quiet authority, "please tell Dr. Harrison that Patricia Sullivan is here to discuss the Thomas Brennan case and veteran care policies at this facility. I believe she will want to see me." Something in General Sullivan's tone and demeanor convinced Mrs. Chen to make the phone call. Within minutes, Dr. Harrison was walking quickly toward the main lobby, her face showing a mixture of curiosity and concern. She had no idea who Patricia Sullivan was, but the name had sounded official enough to warrant immediate attention, especially given the ongoing controversy surrounding the veteran patient. "Miss Sullivan," Dr. Harrison said as she approached, "I understand you wanted to discuss one of our patients. I'm Dr. Rebecca Harrison, Chief Administrator." General Sullivan extended her hand for a firm handshake. "Actually, it's General Sullivan, United States Army. I'm here to discuss your treatment of Mr. Weak, Thomas Brennan, and your termination of Nurse Sarah Martinez." The color drained from Dr. Harrison's face. She had been dealing with negative publicity and community pressure for several days, but the arrival of a 4-star general took the situation to an entirely different level. General Sullivan's tone was professional but carried an unmistakable authority that made it clear this was not a casual visit. "General Sullivan, Dr. Harrison stammered. I wasn't expecting military personnel to become involved in this matter. Perhaps we should discuss this in my office? I think that would be appropriate, General Sullivan replied. I'm here because I'm deeply concerned about how this institution is treating American veterans and the healthcare professionals who care for them. As they walked toward the administrative wing, Dr. Harrison's mind was racing. She had no idea why a four-star general was personally involving herself in what she had tried to present as a routine personnel matter. The presence of such high-ranking military personnel suggested that this story had reached levels of attention she had not anticipated. In her office, Dr. Harrison offered General Sullivan a seat and tried to regain her composure. General, I want to assure you that this hospital provides excellent care to all patients, including our veteran patients. The situation with Nurse Martinez was a personnel matter involving policy violations, not a reflection of our commitment to veteran care. General Sullivan studied Dr. Harrison carefully before responding. Dr. Harrison, I've read the newspaper account of what happened here. I've also done some additional research into this hospital's policies and practices regarding veteran patients. What I've learned is deeply troubling. The general opened her briefcase and pulled out a folder containing documents she had requested from various military and veteran organizations. Your hospital receives significant federal funding for veteran care through various programs. You also benefit from tax exemptions as a non-profit institution serving the community. With those benefits come responsibilities to provide appropriate care to the veterans who have served our country. Dr. Harrison felt increasingly uncomfortable as she realized this was not going to be a routine conversation that she could manage with standard corporate responses. General, I assure you that we follow all federal regulations regarding veteran care. Our policies are designed to ensure appropriate treatment while maintaining fiscal responsibility. Fiscal responsibility, General Sullivan repeated, her voice carrying a note of controlled anger. Dr. Harrison, we're talking about a nurse who was fired for ensuring that a Vietnam veteran received adequate nutrition during his recovery from a heart attack. The additional cost was approximately $15. Your hospital's annual revenue is over $200 million. General Sullivan leaned forward in her chair, her eyes locked on Dr. Harrison's. Let me tell you about Thomas Brennan, Dr. Harrison. He served 2 tours in Vietnam, was wounded in action, received a Purple Heart, and has spent the last 50 years living quietly and asking for nothing from his country. When he needed medical care, he came to your hospital trusting that he would be treated with dignity and respect. Instead, he became the unwitting cause of a compassionate nurse losing her livelihood. Dr. Harrison tried to interrupt, but General Sullivan continued. And let me tell you about Sarah Martinez. Her father was Sergeant First Class Miguel Martinez, a combat medic who served under my command in Afghanistan. He saved my life and the lives of countless other soldiers before giving his own life for his country. His daughter inherited his commitment to serving others and his unwillingness to abandon those who need help. The revelation that Sarah Martinez was the daughter of a decorated soldier who had served under General Sullivan's command changed the entire dynamic of the conversation. Dr. Harrison realized she was not just dealing with a concerned military officer, but with someone who had a personal connection to the nurse she had dismissed. I fired the daughter of a war hero for showing kindness to a Vietnam veteran, General Sullivan continued, her voice becoming more intense. Dr. Harrison, do you understand the implications of what you've done? You've sent a message that compassion is a liability, that caring for veterans is a burden, and that healthcare workers should prioritize bureaucracy over human dignity. Dr. Harrison attempted to defend her decision. General Sullivan, I understand your concern, but we have policies that must be followed. We cannot allow individual staff members to make arbitrary decisions about patient care and billing. The hospital has financial responsibilities and regulatory requirements that— Stop, General Sullivan interrupted, her voice cutting through Dr. Harrison's explanation like a blade. Dr. Harrison, I've spent 35 years in the military, including significant time overseeing medical operations and veteran affairs. I understand policy and procedure better than most. What I also understand is leadership, responsibility, and moral courage. General Sullivan stood up and began pacing Dr. Harrison's office, her military training evident in her bearing and movement. A good leader knows when rules serve the mission, and when they get in the way of doing what's right. A responsible administrator finds ways to support staff who are acting in accordance with the organization's stated values. And moral courage means standing up for what's right, even when it's difficult or costly. You had an opportunity to show leadership when this situation arose, the general continued. You could have worked with Nurse Martinez to find a solution that honored both hospital policy and the special needs of a veteran patient. Instead, you chose to make an example of someone whose only crime was caring too much. Dr. Harrison was beginning to realize the severity of her mistake, not just in terms of public relations, but in terms of moral leadership. General, perhaps there was a better way to handle the situation, but the decision has been made, and we cannot simply— The decision can be unmade, General Sullivan said firmly. Dr. Harrison, I'm not here to destroy your career or damage this institution, but I am here to ensure that both Thomas Brennan and Sarah Martinez are treated with the respect they deserve. More importantly, I'm here to ensure that this hospital develops policies and practices that properly honor the veterans it serves. General Sullivan returned to her chair and pulled out another document from her briefcase. This hospital participates in several federal programs that provide funding for veteran care. Those programs have specific requirements regarding quality of care, patient advocacy, and staff training on veteran-specific needs. Based on what I've learned about this incident, I have concerns about whether this institution is meeting those requirements. The implicit threat was clear. General Sullivan had the authority and connections to trigger federal investigations that could jeopardize the hospital's funding and certification for veteran care programs. Dr. Harrison understood that she was facing a situation that could have consequences far beyond the termination of one nurse. What are you proposing, General? Dr. Harrison asked, her earlier defensiveness replaced by a more collaborative tone. First, Sarah Martinez should be reinstated immediately, with full back pay and a public apology for the inappropriate termination. Second, Thomas Brennan should receive assurance that his care will not be compromised by financial considerations for the remainder of his stay and any follow-up treatment he requires. Third, this hospital should implement comprehensive training on veteran care and develop policies that ensure veterans receive appropriate support and advocacy. General Sullivan paused, allowing her words to sink in. Dr. Harrison, this is an opportunity for your institution to demonstrate real leadership in veteran care. You can choose to be known as the hospital that fired a nurse for caring, or you can become known as an institution that learned from its mistakes and became a model for how veterans should be treated. Dr. Harrison was quiet for several minutes, considering her options. She recognized that General Sullivan was offering her a way to resolve the crisis while potentially turning it into a positive story about organizational learning and improved veteran care. The alternative was continued negative publicity and potential federal scrutiny that could have lasting consequences for the hospital. General Sullivan, if we were to reinstate Nurse Martinez and implement the changes you've suggested, would you be willing to work with us to ensure we develop appropriate veteran care protocols? Dr. Harrison, I would be honored to help this institution become a leader in veteran care. But understand that this is not about public relations or damage control. This is about doing what's right for the men and women who have served our country and the healthcare professionals who care for them. The meeting concluded with Dr. Harrison agreeing to immediately begin the process of reinstating Sarah Martinez and developing new policies for veteran care. General Sullivan agreed to provide guidance and resources to ensure the hospital's efforts were meaningful and effective. As General Sullivan left the hospital, she made one more